you have to think about the prevention. And there will be the necessary steps to make the right prevention, not in the theory, but in the daily business, so that there you have a cut, so there will be no rising costs for cardiovascular diseases. Cardiovascular diseases are one of the main topics in Europe, also for deaths. With prevention, you can make very significant input for having less patients in the hospitals and lower costs for the whole system. It's not only for Europe, but it's worldwide, having in mind all these aspects from the WHO that what healthcare has to be, that a significant role is playing by prevention. We have the possibility to have the eHealth since June in the main entrance of the University Hospital. This is something very innovative, very new, also for us as a University Hospital, to have such method and such solution of giving that there is no other person to have a measurement of parameters for the individuals in an automatic way. It's a very great opportunity also in this innovative digitalization, but also prevention side for the users. In the last 9 months, we have had 5,508 users, 1,308 users since 2 months gave us their data for analysis, and we are looking forward for more data, for more information, for more possibilities. We are analyzing the data, and we are analyzing this data in different ways. One way is to see and to compare it, what about the data from our individuals, comparing it with public health data and WHO data in our region. And there we can see that there are similar outcomes. And on the other way, we try to analyze them so that we can have new findings in the outcomes, and maybe also to see a correlation between some vital parameters, and to make also secure patient pathways regarding the outcome of the data. But we want not only to have the eHealth for having the measurement of the vital parameters for the individuum, but we wanted also to close the loop and to make a secure patient pathway in our clinic. And so we established, together with Medicubex, a system that if 2 parameters is over the threshold and there is a QR code, and you can scan the QR code and you can compare it, and 2 of them is over the threshold, you can make an appointment in the cardiology department. We analyzed that 17 of them have new diagnoses, 21 of them has a new medication or changed the medication, and 1 of them have also an intervention in our cardiology department. We go stepwise. We wanted first to see what about having the eHealth in our University Hospital Frankfurt, and then to see how the patient pathway is working. And now we are preparing to make a cost-effectiveness analysis so that we have also data in this category. It's not our goal, it's not a business, but we think that with this methodology we can have also a system to have a possibility to reduce costs. And this is also a target for the whole system. But it's not only from this pathway, but you have to think about the prevention. And there will be the necessary steps to make the right prevention, not in the theory, but in the daily business, so that there you have a cut, so there will be no rising costs for cardiovascular diseases. I cannot imagine not having the eHealth cube. What I'm looking for is that we have also other cubes, eHealth cubes, not only here in the hospital, in the University Hospital, but maybe also in Frankfurt or nearby, to have the possibility to give this scoring, this measurement to other people outside the city maybe also, and to have a wider population, to giving them the possibility for having their vital parameters. I would 100% recommend having the eHealth cube also for other institutions or hospitals. I think that there will be, and Medicubex will give the opportunity to make a tailor-made system for the needs. And we are looking forward to have this possibility not only here in the University Clinic Frankfurt, but hopefully for Frankfurt and outside of Frankfurt. And we are looking forward for cooperation together with Medicubex, also with industry.